So you want to know about myasthenia gravis. The term myasthenia gravis comes from Greek and Latin words meaning great muscle weakness. MG, or myasthenia gravis, is a disease that affects muscle action. It does this by inhibiting the natural action of a chemical in your body called acetylcholine. Your nerves are like the mail carrier, delivering acetylcholine to various muscles, or various mailboxes, throughout your body. At the cellular level, there are sites on your muscle fibers that welcome the chemical acetylcholine. Once the nerve mailman delivers the chemical to the muscle, normally a cascade of reactions takes place and a contraction or flexion of that muscle occurs. Whether you're playing a video game, whether you're reading a book, lifting a truck off of a small child, your muscles require acetylcholine to create movement. The key factor in MG is related to your body's ability to fight off illnesses. Another system, called your autoimmune system, gets confused, and instead of destroying foreign invading germ cells, it attacks the cells or mailboxes at your muscle, meant to receive the acetylcholine packages. With a disruption in the mail services, muscles don't contract. Often only some of the mail gets through, which slows the muscle action or weakens the contraction or uses up all the acetylcholine available too quickly, results in someone becoming tired. This fatigue can vary. It can be felt quickly and intensely or happen progressively through the day. This is called a disease that is heterogeneous, meaning it takes many forms and varies in its intensity from day to day and its effect from person to person. Things that make it worse are not getting enough rest, exposure to excessive heat, too much exercise, or a severe cold or lung infection. In fact, those with MG often get severe upper respiratory infections, possibly due to the fact that the muscles involved in respiration are weak and cannot conduct or cannot cough out the fluids that produce in the lungs. How does the disease work? How would I know if I have it? There are some nerves that are more susceptible to this disease. These are the 10 cranial nerves most often affected. Those that start in the head but travel out to the muscles of the eye, throat, and upper chest. Sometimes MG will affect muscles further from the head, like the shoulders, arms, hands, and fingers. Symptoms have fancy names like ptosis, diplopia, dysarthria, dysphagia, and myasthenic crisis. But they simply mean droopy eyelids, double vision, shortness of breath or difficulty swallowing and chewing, or respiratory muscle paralysis, the last of which can be fatal. If you are a woman in your 20s, you are 2 times more likely to have this disease than a male friend. Men are most often diagnosed in their 40s, and late onset MG makes up 60% of the cases diagnosed. But what are your chances really? First, scientists currently do not believe MG is hereditary, and you cannot catch it. Approximately only 20 people in 100,000 have it. In other words, 1 in 10,000 are your chances, or your odds of developing myasthenia gravis is less than having twins, getting cancer, or becoming divorced. Hey, I'm just saying. Why is it important to know this? Well, myasthenia gravis is the most common neuromuscular disorder of the neuromuscular junction. That's the location where the mail carrier delivers the packages. Or, as I said, the nerves send the ACH or acetylcholine to the muscle cell receptor sites. People with MG have trouble breathing, swallowing, and talking. If you're having breathing trouble and need help but cannot speak, the chances of getting that help diminishes. You might be in serious trouble and need to get to the hospital. Quality of life can be negatively affected with this disease. It is difficult to have a job, go to school, care for a family when you are fatigued. At some point, often that fatigue is so severe that someone cannot move their arms above their head or even swallow. What does research tell us? MG is never the same for each person. One theory is that a gland, known as the thalamus gland, causes MG. It affects the delivery system of acetylcholine because the release of it is dependent on hormones produced in the thalamus. Specifically, the thalamus produces ACH receptor antibodies, blockers that interfere with the neuromuscular transmission, or, keeping with my analogy, the family dog to the mail carrier. Thymomas are suspected to be the reason for the interference. These tumors are responsible for 10 to 15%, or 3 out of the 20 diagnosed cases of MG. You're probably thinking, this is fascinating, I can't wait to know more. Tell me more about the research and the pathophysiology, quick! Okay, sit back down. Research studies have uncovered the main characteristics of the disease. Individuals with MG have increased weakness with exercise. As well, respiratory muscle endurance is low. Weakness of respiratory muscles can lead to the most severe complications. Bronchial pneumonia is one of them, respiratory failure is another. There has been research into training the respiratory muscles. This form of endurance training for respiratory muscles is accomplished through a portable device. Its name, normocapnic hyperemia. I didn't say that right. You can look it up. In MG, antibodies from the thalamus gland are produced and they attack the acetylcholine receptor sites. There is a decrease in the number of receptor sites and there is an ineffective retention of acetylcholine. Both of these contribute to weakness and fatigue. One last comment on the research. Symptoms of muscle weakness can also be due to impairments in the excitation-contraction coupling and contractility in patients with MG. Those antibodies we spoke of are in the blood serum binding to the actin and myosin and other components of the sarcoplasmic reticulum. Now you're thinking, OMG, how do you treat this? Well, myasthenia gravis can be difficult to diagnose. There are several tests. A blood test to perform would be to identify the presence of acetylcholine receptor antibodies. There's also the use of electromyography, EMG, and that evaluates the electrical activity produced in skeletal muscles. There's also pharmacological testing. As of right now, there's no cure for MG. However, there are other options that can be done in order to manage MG. Treatment to manage MG includes plasmapheresis, thymus gland surgery involving a thymectomy, and drugs. Plasmapheresis can help reduce weakness and improve muscle strength through the removal of antibodies in the plasma. The medications suggested all inhibit the inhibitors, which means they stop the thalamus gland's antibody production. This allows the acetylcholine receptors to function normally. Another pharmacological solution is immunosuppressive drugs. Suppressing the immune system means that less often we are attacking our own cells at those receptor sites. These treatments can result in what's called remission, where the symptoms of the disease either altogether disappear or diminish significantly enough to improve quality of life. Interestingly, one study found that resistance training combined with creatine resulted in an increase in body weight, fat-free mass, and the upper body load volumes. Load volumes going up and peak strength going up are better for those with MG. There are many unpleasant side effects of the immunosuppressive drugs. These drugs, with their bad side effects, have been reduced and sometimes delisted in the treatment options for those with MG. Ultimately, it's unknown why people with MG produce antibodies that attack their acetylcholine receptor sites, creating the muscle weakness. Finding out this information would help in discovering a cure. On a personal note, my best friend Nang has myasthenia gravis and was diagnosed shortly after her first pregnancy. She competes as a Paralympian triathlete and is a mother of 3 young boys. She has undergone 3 surgeries on her eye muscles and does not use medication to manage her MG. She has at least 1 bronchial pneumonia episode per year that requires complete bed rest, but otherwise she is a very vibrant person living a full and productive life. Her favorite thing to say is, "There is no cure, but there's always an answer."